So most of the ideas that I think about is something that I really want for myself. So starting with a journal of case reports. So when I was writing papers, a lot of papers, I wanted a journal which was dedicated to case reports, which where I can send a lot of my material since the major journals were not accepting them. So I created JOCR. Same with Ortho TV. I wanted to have a look at all the conference videos where multiple halls are running and the important sessions that I was missing. So similar thing is with online fellowships. So when I'm now busy with my academic work and my clinical work, and I can't leave that and go and get attachment with a mentor, and so physically it is not possible for me. So that is where the idea of online fellowship uh, started. So it is like for myself, I want to go and do a fellowship with, say, uh, Dr. Mohit Bhandari or Dr. Jawad Parvezi. So how is it possible if I cannot leave physically? So that's where the concept is. And as a disclaimer, we started the idea, so it might look like we are promoting the platform and things like that, but I'll just showcase what the idea is. The concept was very, very simple. So it is somewhere between a physical fellowship and an online course. So an online course where you watch videos for a few hours, but you don't develop a rapport with a mentor. Here we try to develop your rapport with the mentor. So there is educational content, there is social aspects, there is talking to each other. So and a constant uh, say togetherness for around 2 months. So it emerged for pandemic, as Ashish said, where we all, most of the orthopedic surgeons, we got into the habit of learning from videos, learning from online events and things like that. And there was a huge response. So that is a cultural change that happened with a lot of us, where we were primed to. Before that, educational programs were happening online, but I don't think the response as well as the reception of it was so good. So it is the acceptance of online education, and through that we saw that there is a lot of people, especially in periphery, especially in practice for 10 years, 15 years, want to do kind of in-depth learning. Not only learning from a webinar of half an hour, but they want to actually talk to mentors, talk to teachers for a prolonged period of time, show them their cases, interact with them. So that is where the idea of the entire online fellowship was conceptualized. There were two basic principles that we harped on. One is rational decision making. So this is the point that people will learn from online fellowship, and reducing complication, making your surgery safer. So these are the 2 points on which all our curriculums are made. And we speak to the mentors, ask them that all their lectures as well as the entire uh, format of the fellowship is based on these 2 points. So we increase the logical approach to decision making as well as teach them tips and tricks to reduce the complication. So it's kind of purely academic, uh, more theoretical kind of fellowship, but we have a lot of surgical videos, a lot of case-based presentation. So one is, like I said, one is mentorship. Through mentorship, once they start interacting not only with mentor but also with each other. So we have around 50 to 100 fellows in each fellowship batch. They not only interact with mentor, they also interact with each other, and they also present their cases. So it sparks kind of critical thinking in a group, and most of it is based on practical knowledge. So that's what we are trying to propose. It's kind of in part between physical and online. And India is the first where we started this. So that's something we are proud of. So continuous access to the mentor through WhatsApp groups and case presentation through WhatsApp. So you're for 8 weeks or 12 weeks, you're together with the mentor constantly through a virtual platform which is commonly used. So that gives a kind of great interaction. Most of the fellows and the mentors, now when they meet physically, they can interact much more freely. So earlier when so like Dr. Tanna is running trauma fellowship or Dr. Guru Reddy is running arthroplasty fellowship. The virtual fellows, when they meet them in physical conferences, they are much more approachable to them. They the mentors actually behave like mentors and talk to them, guide them into various aspects, not only just cases, but even a lot of career guidance, lot of other things. So it opens a channel for you to get access to the mentor. That is one of the major things that these virtual fellowships look at. So there are weekly live Zoom sessions. Typically, they are 8 to 12 weeks. Every week there is a theme, and there is a Zoom meeting of 90 to 120 minutes every week. But WhatsApp communication goes on like continuously. So we have the best mentors. So Dr. Viga Agashe, Dr. Tanna sir, Rajiv Shah, Guru Reddy, the entire iFix team, which is running the iFix program today. We also have Dr. Mangal, Dr. Heyman, Pachure sir, Aditya, Abhay, and Sancheti sir, all part of the team, and they are taking various courses and various fellowships. So who can apply? I think, um, like I said, it is basically an academic fellowship only to achieve 2 points. One is rational thinking, and second is to reduce complication just by learning from a mentor. So we don't have very strict parameters for that. It's just 2 years post MS or postgraduate degree, whatever you have. So specific fellowship, if you have prior experience in arthroplasty or have some papers, so that will be much more preferable. We even reject fellowship, so it's not like we take everybody who applies. So they are most of them are experience-based modules. These are all curated by the mentors. So Ortho TV team as well as the mentors both curate together the entire program. So this is one of the major advantages, like Ashish mentioned. Fellows can attend this fellowship while they are doing their jobs and their private practice. So it also gives most of them will present cases that they have seen on that day or on that week or that month. So they get a kind of real time guidance from the mentors. These are the disadvantages. There is no surgical hands on experience. It is it depends on how much is the fellow inclined to learn. What we have seen is that mentors are always inclined to give knowledge. Many times it is the fellows who fall short of, uh, say, attending the meeting, asking more questions. So that is where I think even in physical fellowship, that is what happens. These are the add-ons which we have kind of planned that we'll have a physical event at the end of every virtual fellowship or have a short-term observership with mentors. We had also done category course for foot and ankle fellowship. We had done conference registration. So Dr. Guru Reddy, at the end of his fellowship, announced special uh, package for the fellows for each conference. VR modules are in development. I think within 2 3 months we'll release the VR modules and also research. So we had more than 1,000 fellows in last 2 years. So we started in 2021, so 3 years on from India, Middle East, Africa, Asia Pacific. So a lot of fellows have joined us over last 2 years. And this is what we have achieved over, I mean, after the feedback that we got from fellows. So we have created a network of mentors and fellows. Even after fellowship that have ended 2 years, they are in touch. They are interacting online on WhatsApp group. They are talking to each other, the mentors and the fellows, and also the fellows amongst each other. It has definitely reduced complication according to the survey we have taken out and improved patient outcome to a certain extent. This was one of the cases that one of the fellows sent me that he has seen this non-Indian and he could achieve this kind of, plan this kind of surgery just because of guidance from the mentor. This is the trauma fellowship that was happened. So we are trying to fill a gap in surgical training by enhancing the quality of education and care. So um, Well, like I think Prashant made the point, when we are doing a residency, we are more into, say, hands-on training, more into the surgical part rather than critical thinking part or the research part. So I think we that is what we are trying to aim at. And we are again evolving to more platforms. So this is the Ortho TV global platform that we have created, where we have virtual fellowships, courses, and CMEs as well as physical events that are planned according to around the fellowships. So this is the Ortho TV Academy platform where things are happening. What we are adding to our future fellowships is the AI enhanced fellowship. So we are going to curate Ortho AI subsections based on the past fellowship as well as the videos of the mentors, so that when fellows join us, they can have kind of enhanced experience with AI. Opportunities from the mentors. So a lot of these mentors have a lot of data, but again, they are busy in the practice, don't have time. So we are trying to get fellows who are interested in research, liaise with these mentors to create more papers and publication for the mentors so they can share the authorship. This is one of the websites that we created after we learned that a lot of people are interested. So a lot of Indian fellowship as well as certain fellowships where Indians can apply is being posted on this site. You can scan the code and know more about us. So if Neeraj wants to add anything more, uh, that's the end of my presentation.